Together we achieve victory over heart failure.
Welcome, listeners. I'm Dr. Archana Tapdiya, consultant cardiologist Amravati, and today we delve into a very critical aspect of cardiology, that is heart failure. We all are bombarded by a lot of information about heart attacks, but still there is a lot of confusion regarding heart failure, and we are here to address that. So, what exactly is heart failure? Heart failure is also known as congestive cardiac failure, and it is a condition in which the heart is unable to pump the blood effectively to meet the body's needs. In simple language, it means that the contractility of the heart has gone down so that it can no longer be commensurate to the needs of the body. It can result from various conditions, the most important being coronary artery disease, that is, if there are any blockages in the coronaries, very high blood pressure which is untreated, as a sequelae of very high blood sugars, genetics, then a few post-infective viral conditions, and a lot more. So basically, now what is heart failure and what happens? It is very difficult to notice heart failure right away. But as our body or as our heart faces increased strain, it compensates by working harder. Yet, as heart failure progresses, its ability to pump blood diminishes gradually. So, over time, the subtle changes may go unnoticed, emphasizing the importance of recognizing heart failure symptoms. Now, as we go to the symptomatology, most of the symptoms are because of fluid accumulation in the body because the heart is unable to pump now. So, the patient can come with palpitations like noticing a rapid heart rate, then shortness of breath during daily activities, which he used to do before and now they are unable to do it, or interruption in breathing due to persistent coughing or wheezing. Then the other important complaints can be nausea, vomiting, a fullness in the abdomen, swelling over the feet, ankles, abdomen, puffiness of face, a sudden weight gain. Symptoms might also range from fatigue, confusion, drowsiness, fainting in the elderly because of inadequate blood flow to the brain. So, if anyone notices any of these signs, please seek prompt medical care. Now, some of the myths, we would address some of the myths which are surrounding heart failure. Let's dive in and clear up the fog of misinformation. The first and important myth that heart failure targets only the elderly. While heart failure is more prevalent among older adults, it can unfortunately strike at any age. Factors like genetics, lifestyle choices, underlying heart conditions can also contribute to its onset, making it a concern for individuals of all ages. The second and the most important is people think that what heart failure means that the heart has stopped. No, it doesn't signify a total shutdown of the heart. It only refers to a condition where the heart is struggling to pump blood efficiently throughout the body. This can be easily diagnosed by ECG and echocardiography as to how much is the ejection fraction or pumping or contractility of the heart. Then the other important myth is I shouldn't exercise after having a heart attack. Again, a no no. Exercise is a cornerstone of heart failure management, but it has to be customized and done under judicious professional guidance. Please listen to your doctor. They'll tell you as to how much you can exercise depending upon the contractility of your heart and the other medical conditions which you are facing. So, regular physical activity can really boost up cardiovascular health, it can boost up endurance, and significantly, it enhances the overall well being of individuals with heart failure. The treatment modalities are actually directed at throwing out the lot of fluid which is built up in the body because of heart failure. So the doctor would be prescribing medicines in which the fluid is lost a lot through urine. Then you will have to have lifestyle modifications, especially in diet and exercise. And sometimes in the long run, patients may require medical devices, pacemakers, or surgery depending upon the severity. So, managing heart failure requires regular medical checkups, adherence to treatment plans to improve the quality of life and reduce complications. Please do not be afraid of that. We have patients with a contractility of 11%, 12%, who are living a good life since 10 years, 12 years. Don't be afraid of a low ejection fraction or contractility. With proper care and treatment, individuals with heart failure can lead fulfilling lives, navigating their conditions with resilience and determination. Hope this information has been helpful for you. Thank you for listening.